who's a PhD student and assistant teaching professor. And Leslie Hodge is here to talk to us about critical posthumanism. I came across her article and was like, this is really exciting. Can you come talk to us about it? So welcome.
Thank you so much, Claire. And I see the recording has started, so I'll just get into it. So great to meet you all. Like Claire said, my name is Leslie, and I am a PhD student and assistant teaching professor in the Faculty of Nursing at the University of Alberta. And two of my mentors, Drs. Kelliguru and Olson, could not be here today, but they are key collaborators in my work. So I really appreciate the opportunity to speak today, and I'll focus my presentation on critical posthumanism, a theoretical perspective. And please keep in mind, as you're listening, I'm an emerging scholar and early in the development of my theoretical ideas. But that being said, I hope that throughout this presentation, you can begin to imagine a world where the boundaries between humans, technology, and nature are blurred, and one where we as humans are always changing in relation to others. This is the world of critical posthumanism, and I think it has important implications for environmental justice, planetary health, and nursing knowledge. So I know ANHE is a global leader in planetary health, and I thought I would share where I'm situated in Alberta, Canada, about where I've circled on the map. And the colors on the map that you see represent 11 treaties signed in Canada in the 18 and 1900s between settlers and Indigenous peoples. And I'm located on Treaty 6 territory, which is the traditional lands of First Nations and Métis people. So the overall structure of this presentation is going to be fourfold. First, I'll discuss critical posthumanism, the limitations and nuances of this perspective. Next, I'll share how I see critical posthumanism as aligned with and complementary to environmental justice. Third, I'll talk about how this theoretical perspective can be used as a tool to develop knowledge supporting planetary health. And last, I'll share some examples of how all of this could be applied to nursing. And my hope is that at the end of this presentation, we can talk more about the challenges and possibilities of using this theoretical perspective. So first, I'll focus on critical posthumanism. The image of a sword is in reference to a paper that Claire mentioned that I published with Dr. Olson entitled Critical Posthumanism, a Double-Edged Sword for Advancing Nursing Knowledge in Planetary Health. And to me, the imagery is apt because it immediately recognizes that this perspective, like many things, is limited and flawed. It holds the potential for harm and help. And before getting into exactly what critical posthumanism is, I just want to highlight two limitations of this perspective right off the bat. The first is that critical posthumanism is really abstract. In nursing, we would call it a meta theory because it operates at a conceptual level and it critiques foundational assumptions about human-centered care and practice. The second major criticism is that this perspective only takes issue with white and Western humanism. So Rebecca Chassamni-Alice, for example, challenged the white normative lens, providing a move to post-human perspectives. And she pointed out that not all forms of humanism are problematic. Critical posthumanism sees that white humanism is indeed problematic, so it can be critiqued for being Eurocentric in that regard, because it only takes issue with one type of humanism, and one that I would argue has had a pretty big impact on the world. So with those two limitations in mind, what is critical posthumanism? So post suggests after or without, and one might infer that critical posthumanism means after humans or without humans. But nursing scholars Dillard Wright and colleagues said in 2024, and I quote, that posthumanism is post in the same way that the world is post-pandemic. Just as there is no world untouched by COVID-19, there is no present unfolding that does not bear the imprint of humans. So simply put, Critical posthumanism is a perspective that foregrounds the imprint that humans, particularly white humans, have had on the world. Critical posthumanism challenges humanism. Humanism is represented here by Da Vinci's Vitruvian Man, and it privileges certain human characteristics, being white, able-bodied, and male, for example, over others. This perspective also takes issue with anthropocentrism, meaning human-centered. And this problematic ideology is shown by the hanging octopus. And I know this image is disturbing, but I imagine it would even be more shocking if the image were a hanging human. So these different standards, animal and human, suggest that we place human life above many other living things. And critical posthumanism problematizes these ideologies, humanism and anthropocentrism. And instead, it encourages us to see the complex and intertangled relationships between every entity on Earth, deeply interconnected with no clear start or endpoints. And those relationships exist among humans, animals, technology, and even other less obvious elements in our environment, such as microbes, for example. I think a tree rhizome helps us understand how relationships from a critical posthumanism perspective actually operate. The word rhizome was initially used to describe plant structures, but as you may know, philosophers Deleuze and Guattari use the term rhizomatic metaphorically to describe interconnected systems or concepts. So just as these roots spread and intertwine with no clear beginning or end points, rhizomatic relationships are just as deeply entangled. So while humanism has created some problematic human-constructed hierarchies, critical posthumanism illuminates entanglements. For example, through critical posthumanism, we would see that the technology of our mobile phones, for example, is so intertwined in our daily life that it's really difficult to discern where does our technology end and our human life begin. Through this perspective, we would also see how policy decisions made in one country affect biodiversity in another. And as Dr. Petrovska said, the human is not in the world, but of the world. And recognizing entangled relationships stands in stark contrast to traditional humanistic views that tend to organize relationships in really clear, linear hierarchies. And all of this talk about relationships is really about ontology. So before delving further into the theoretical perspective, I just want to clarify what ontology means for anyone who might be less familiar with the term. So as Dr. Mayan put it, ontology is a study of existence and reality and whether things really exist or whether we as humans decide that they do. So for example, in nursing, we might assess a patient's pain on a scale of 1 to 10, but pain is really difficult to measure objectively. So we can view pain as something that is constructed based on can we view pain as something that is constructed based on our experiences and perceptions? And how do we reconcile pain's biological basis with how personal and social factors shape the way that we feel? These are ontological questions, and in nursing research, we often recognize there can be multiple truths or ways of understanding reality, rather than just one objective truth. So, given that understanding of ontology, here's a visual depiction of the theoretical structure of critical posthumanism. I know it looks a little dry and complicated, and we'll walk through one section at a time. At the bottom, you can see that the ontology of this perspective is monistic, which simply means we're all one. We're one with technology, we're one with nature. In fact, our well-being depends on it. And we're deeply entangled with people in power, even if human-constructed systems suggest otherwise. But Braidotti's articulation of critical posthumanism adds a unique twist to monism. She draws on Spinoza's concept of radical immanence to suggest that all matter, whether human, plant, animal, or technological, is intelligent and self-organizing. Some might even argue that non-human matter has agency because of its influence on other matter around it. Beyond its ontology, there's another important concept on the top right of the circle called becoming. And the concept of becoming suggests that there's not one fixed human identity. Rather, becoming suggests that as humans, we're always changing in relation to others through interactions. And one example of how to think about becoming is to imagine an interaction you've had with someone you disagree with. And through a difficult conversation, both you and that other person are fundamentally changed, even if you might be replaying interactions in your mind as if they're fixed. But critical posthumanism suggests that nothing is fixed, including our individual human identity. In the top of the circle is affirmative ethics. And simply put, this refers to a political practice that involves sitting calmly together with other people and discussing negative conditions that shape our world and our lives. And the negative conditions we should discuss democratically include things like pain, suffering, trauma. And this practice can play out one-on-one, or it can occur in what Braidotti called assemblages with groups of people. But regardless of the volume of people involved, engaging in affirmative ethics can be impactful when done among people sharing diverse perspectives, particularly when people disagree. And Braidotti argued that the practice of affirmative ethics is unfortunately not the norm. We see polarized discourse operating at national levels, and even in healthcare, nurses often lack the critical space to discuss broader conditions shaping their practice. Yet, a critical post-human perspective suggests that cultivating a calm space is critical for becoming. And so in practicing affirmative ethics, we can become the humans who have the capacity to collectively and meaningfully address negative conditions, whether that is in healthcare or beyond. I'll move down to the middle of the circle and the arrows that are both pointing in the same direction. The arrows are meant to convey the idea that critical posthumanism brings two fields of knowledge together, post-anthropocentrism and posthumanism. And simply put, post-anthropocentrism takes issue with the unnecessary suffering of non-humans. The unnecessary suffering of non-human animals, and posthumanism takes issue with power imbalances among people. And these two fields of knowledge, post-anthropocentrism and posthumanism, they intersect on a spectrum shaped by cognitive capitalism. And that may be a new term for many, as it was for me. And simply put, cognitive capitalism, it refers to an advanced form of capitalism where knowledge, creativity, digital information are transformed into profit through technologies like social media and even search engine platforms. And these platforms exploit and commodify data, including metadata and other digital information, to generate economic value. And certainly there is much good made possible through the internet and social media, but it's important to recognize that these platforms are intended to make money, which often involves exploitation. And as Braidotti said, and I quote, capitalism doesn't break, it bends. And it may be problematic at times. So through the lens of critical posthumanism, cognitive capitalism is just another imprint left by humans. So just to summarize this framework, critical posthumanism is a perspective that recognizes our fundamental interconnectedness to everything and everyone around us. It recognizes the imprint that we as humans have had on the world to other people, living matter, like animals and microbes. It also recognizes our entanglement with technology. And through the convergence of two fields of knowledge, post-anthropocentrism and posthumanism, we see on one hand that relationships between all matter is inherently rhizomatic and deeply entangled. And on the other hand, we see a human-constructed world where there are created hierarchies and systems of power at play. And these systems of power are a human imprint that shape planetary health and environmental justice. And this leads us into the next section and second key concept I want to discuss, which is environmental justice. And I've included Kane and ANHE's logos here to recognize that much work is underway in this area, particularly by people in these two nursing bodies. So in this next section, I'll discuss what environmental justice is and how it's evolved into a sub-movement, an arts-based example illuminating environmental injustice in healthcare, and then I'll connect how critical posthumanism intersects with environmental justice and potentially has something to add to this movement. So first, what is environmental justice? As many of you may know, it's a movement advocating for equitable involvement of all people across nationalities and backgrounds in environmental politics. Climate justice is a sub-movement of environmental justice, and it focuses on how people are affected by climate change in their communities. Dr. Astle and colleagues said, and I quote, "The climate justice movement insists on shifting away from the discourse about greenhouse gases and melting ice caps to a focus on the people and communities most vulnerable to the impacts of climate change." What I find interesting is that people are emphasized in both of these definitions, and I believe this emphasis on people suggests a more explicit recognition of non-humans, which are deeply entangled in environmental and climate justice movements. This is why I think critical posthumanism has something to add, or at the very least, be a complementary lens, because it aligns with environmental and climate justice, and it puts further emphasis on the role and agency of non-human forces. So in this diagram, I've combined environmental and climate justice with the original critical posthuman framework to illustrate that these perspectives are complementary. And you might be wondering why nurses should care about these highly theoretical concepts and how they could help these highly theoretical concepts in critical posthumanism and how they could help advance environmental justice. We already know that humans and nature are inseparable and that we face an urgent challenge with the climate crisis. But I think critical posthumanism can speed up our understanding of environmental and climate injustice in healthcare. And I'll share an arts-based example. So these images were created by Christian Tejazukmana, a nurse artist who captured the issue of single-use plastic waste in healthcare. And in the first image, we see the artist himself. He represents healthcare providers drowning in medical waste. And through critical posthumanism, I see that people who were involved in the extraction of fossil fuels and then others who use plastic products, they're not bad people, but they operate in human constructed systems that predate them. The middle image shows a patient who most nurses interact with daily. Now I see that single-use plastic waste is shaping both nursing and patient realities, which is consistent with the monistic ontology that critical posthumanism brings to light. And the final image is of a hand emerging from the single-use plastic waste. And I'm reminded that some people don't have a visible presence or voice in the issue of environmental injustice. So do you need critical posthumanism to understand these relationships? No. But I think using critical posthumanism helps us recognize these kinds of connections more quickly and deeply, just as Christian's photos do. So critical posthumanism reminds us that humanity has had a deep impact on the world. And that leads us to the third section of this presentation, what focused on planetary health. And in this section, we'll cover what planetary health is. It's been conceptualized in different ways, and I'll cover two. And then I'd also like to share how critical posthumanism can help generate knowledge that would support planetary health. And I'll share two planetary health frameworks that you may already be familiar with and use to inform your thinking. On the left, we have the Planetary Health Boundaries Framework, recently updated in 2023 by the Stockholm Resilience Center. And this framework shows us the safe operating space for humanity in green, while the red and orange sections indicate where we've exceeded these boundaries. On the right, I've put what is sometimes referred to as the triple threat: climate change, pollution, and biodiversity loss. And these three interconnected crises, framed by the United Nations, represent the most urgent environmental challenges we face today. And yes, these frameworks give us practical tools to understand and communicate the urgency of addressing environmental health issues. But they don't immediately convey or give us the tools to demonstrate the mechanisms on how each planetary health issue connects to others and leads to further harm. So I think critical posthumanism can help us generate knowledge that can support planetary health. And here I've overlaid planetary health represented by the Earth and the original critical posthuman framework. And there are two ways that I think critical posthumanism can help us generate meaningful knowledge here. The first way relates to planetary health issues themselves. When we exceed planetary boundaries or fail to address the triple crisis, critical posthumanism can help us draw connections between environmental and human concern. For example, using this perspective can help us identify exactly how and why air pollution increases respiratory disease. And critical posthumanism can also help us see the origins of zoonotic or animal-borne infections, such as COVID-19. Critical posthumanism can also help generate knowledge to support planetary health because it suggests how we as humans can work in concert with others to support planetary health and environmental justice. It reminds us to implement practices like affirmative ethics, which, as you may recall, involves discussing negative conditions with others. And with that in mind, in this fourth and final section, practical applications and conclusions, I'd like to share some ideas for how these concepts can be applied to nursing. And here is a figure I developed in collaboration with Dr. Olson, where we overlapped critical posthumanism with some fundamental ways of knowing in nursing. And these ways of knowing are aesthetic, emancipatory, ethical, personal, and empirical. The concept of becoming from critical posthumanism is at the center, and it connects the ways of knowing. And as you may remember, becoming suggests that change is a process, not an endpoint. For example, adopting a planetary health diet or engaging in conceptual mapping, they represent ongoing transformations rather than just immediate or endpoint solutions. So importantly, critical posthumanism isn't about dismantling systems. Rather, this perspective suggests the need to work together, step by step, in the ongoing process of becoming. And I'd like to walk through two examples that combine some of these ways of knowing. The first example is political activism in the context of ethical, aesthetic, and emancipatory ways of knowing. We need to incorporate emancipatory knowing here by amplifying the voices and concerns of those affected by climate change events. And ethical knowing would implore us to assemble with mentors and colleagues. The aesthetic approach encourages us to understand resistance to change at multiple levels. We've all heard, as Einstein suggested, that if we had limited time to solve a problem, the majority of that time should be spent understanding the problem. So we need to understand the perspectives of those we disagree with. And my interest in understanding resistance to change began with a paper I published out of my master's thesis entitled "The Internal-External Dynamic Using Research to Inform Government Policy About Poverty in Canada." And I recognize that poverty and climate change are different issues, but they're both complex, really politicized, and value-laden. And that's just where my research interest just happened to lie. But through this work, I learned that informing government policy in the Alberta context is very possible when external pressures, such as protests and media attention, they're combined with internal insights of people working in those spheres that you want to change. So in this case, informing policy was very possible through collaborative, long-standing relationships where there was sometimes tension and people who didn't always agree. And I'm not suggesting that we should not be political through protests, for example. What I am saying is that activism could be more effective by understanding what perspectives, interests, and human-created structures are making change difficult. So, by understanding resistance to change in a broader effort to advocate for others, a nurse activist would be embodying what Braidotti called affirmative ethics and multiple key ways of knowing in nursing, where we not just recognize oppression, but we also focus on understanding a wide range of perspectives and co-creating solutions. The second example that I'd like to share highlights the importance of personal and empirical knowing in the context of becoming further aware of the connections between animal agriculture and environmental harm. In 2019, as some of you likely know, the Eat Lancet Commission proposed a planetary health diet, and it really emphasizes reducing our consumption of animal products, such as meat and dairy. This shift, there's many benefits. A planetary health diet lowers the demand for growing animal feed, which is far more resource intensive than feeding humans. A planetary health diet reduces the need for deforestation, a key driver of zoonotic or animal-borne diseases, and it decreases the demand for using antibiotics in livestock. And therefore, it mitigates the rise of antibiotic resistance we often see on the front lines of nursing care. So a nurse might adopt this planetary health diet recommendation personally, but they can also apply learnings empirically in their professional practice. So, for instance, a nurse educator could encourage students to use conceptual mapping to explore the interconnected impacts of animal agriculture and public health issues. I chose this image of a tree, which I realize is not a conceptual map, but I believe this image is consistent with the idea of conceptual mapping because the branches appear separate from the ground, but they share a common foundation, an interconnected root system linked to countless other elements in the environment. So through conceptual mapping, nursing students could link planetary health issues like biodiversity loss to broader public health challenges such as zoonotic disease outbreaks and antibiotic resistance. And the approach of conceptual mapping deepens our understanding of our interconnectedness with everything around us. So the last point I'll make on this is that drawing connections also fosters critical thinking in the context of planetary health, which is urgently needed in undergraduate nursing education. And these examples are just some ideas of how we as nurses can apply critical posthumanism to advance environmental justice and planetary health. But I think the real value of this framework lies in how we can collectively adapt and apply it. So I ended a little early, but I'd like to use our remaining time to answer questions and hear about how you might use this framework in your practice. Which brings me to the end. So thank you everyone so much for your attention. Thanks.